Well, as colorectal cancer diagnoses rise among younger adults, the recommended testing age now starts at 45. Dr. Stephen Lee Kong, who we just heard from in that piece, chief of colon and rectal surgery at Hackensack University Medical Center, joins us now to make sense of some of the latest guidelines. Doctor, good to have you with us.
Hi, good morning. Thank you.
Seeing and hearing Jennifer speak so openly about her diagnosis, what was your reaction to that?
I'm actually enthused and happy that she was able to speak about this in public and kind of help us raise awareness about the importance of screening and paying attention to your body and symptoms.
People, of course, want to know what to look out for. March, as we mentioned, marks Colorectal Cancer Awareness Month. What is the main takeaway? People sitting at home right now, what would you like them to have this time of year as it's now on the forefront?
Really have an open and honest conversation with your physicians about symptoms that you may be having, even if you think they're minor, anal bleeding, change in your bowel habits, abdominal pain. And certainly if you're over the age of 45, if you have not had appropriate screening, please talk to your doctors about getting screened.
And how important is it to talk with your physician? You know, as we heard Jennifer mention, she thought she maybe had irritable bowel syndrome. She wasn't really sure what was going on until she actually went and saw a professional.
Exactly right. I think a lot of patients will try and minimize their symptoms and so it's probably my hemorrhoids that are bleeding, or will come up with some other diagnosis that may explain their symptoms. But you know, if you've not had age-appropriate screening, any abnormal symptoms like bleeding or pain, think colorectal cancer until proven otherwise with a colonoscopy.
Your hopes for future treatments here with colorectal cancer. I know things change on a week-to-week basis, but what are your hopes?
There have certainly been great advances in chemotherapy and immunotherapy for patients who are already diagnosed with colorectal cancer, but really spreading the word about decreasing modifiable risk factors like obesity, diet, exercise, and certain environmental factors will help decrease the rates of polyp formation and development of colorectal cancer.
As far as new technology that exists out there, anything on the horizon that you see that excites you as far as treating colorectal cancer?
Sure. In terms of screening colonoscopies, there have been some AI advances in how we actually do colonoscopies and advanced technologies in polyp detection, and certainly those have helped increase the rates of detecting adenomatous polyps, which are the polyps that go on to turn into cancers down the road.
And again, before we let you go, as far as a screening age, I know a lot of, especially men, when it comes to prostate cancer, always hear that 50 age thrown out there, but it's actually earlier. For a number of cancers, you should be getting checked earlier.
Exactly right. And for colorectal cancer, several years ago, all the major societies reduced the age of screening to 45 because of the increasing incidence of cancers in younger patients. Only about 20% of patients between the age of 45 and 49 are screened currently, which is much lower than what we would like. And so, you know, getting the word out about the change in the age for starting screening is important.
If you have any doubts, go to your doctor, get checked out, get colonoscopies, get everything you can done, because again, as we all know with cancer, if you can get it early, get to it early, your chances of survival greatly increase. Doctor, we thank you very much for taking a few moments with us. Good to see you.
Good to see you. Thank you.